Hello everyone, you are watching sqadia.com and I am Dr. Hamad Adil. Today our topic is hip injuries. We have three sections. In the first section we'll be discussing hip dislocation and what it is and what are the different types of hip dislocation, that is the posterior, anterior, as well as briefly discussing about the subtle hip dislocation as well. Along with that, we'll discuss the isolated fractures of the trochanter, the greater as well as the lesser trunk, especially in the young individuals as well as in the older individuals. In the second section, we will be touching in more in detail about the posterior hip dislocation, how it occurs, what is its mechanism, what are its clinical features, what is usually the position of the leg when patient suffers from a posterior hip dislocation, what are the imaging which is required, and how to closely reduce the posterior hip dislocation, what is the different methods, and what if it does not reduce closely, then how to approach this for open reduction. In the third section, we will be going through the femoral head fractures and anterior dislocation. As usually, the isolation, what happens is can be a simple dislocation, which is a dislocation in isolation, or it could be a complex dislocation in which this may be associated femoral head fractures or acetabular fractures as well. So we'll be briefly discussing the mechanism of anterior dislocation, its clinical features, how to treat it, and how to manage anterior dislocation. Along with we'll be briefly touching upon the Pepkin classification of femoral head fractures as well, and what its importance and whether what type of reduction is required in case of if it is associated with femoral head fractures. Thank you very much. Keep watching sqadia.com.